In the first 10 days that the nurses were in Regina here, we had 50 calls for service in the OCC where they could directly help. So 50 different calls where people were in mental health crisis or addictions crisis where they needed help, and those nurses were able to like jump right in there and help. Now, just a big point of that, there was in all those 50 cases, there were 17 times where police did not have to make an arrest and did not have to take that person to the hospital in handcuffs or into our cells in handcuffs or anything like that. The nurse was able to intervene and do an assessment, do a referral, things like that, hook them up with community resources. So never had to do our old-fashioned way, which is apprehend, go to the hospital, sit and wait. So that's huge in the first 10 days. So right now we have 2 nurses. The pilot project actually calls for 4. So there's 2 more nurses in the process of being hired, and once that happens, we'll be able to offer the service 24 hours a day, 7 days a week. That's the plan. We're not trained mental health professionals, but we're trained to help, how to de-escalate situations that involve mental health, but we're not professionals, and we know that, right? So that's why we said, why not bring professionals to the table? We've done that. So we get to the scene, and now a member can get on this and can actually phone that psychiatric nurse, even before they deal with the person in crisis, to say, listen, this is what I'm going to, this is what I think I have, what can I do? And that nurse can even tell the member, you know what, sometimes these are triggers, sometimes there's things like this you can try to do so that it can de-escalate the situation more efficiently. So there's that part of it. And then once they get there and the scene's safe, then the nurse actually talks to the person in crisis right there on scene, and then can start doing their assessment, offering resources, those types of things, right? Because we wanted to respond to people that were in mental health crisis and addiction crisis in a different way. We've always been doing it one way. The only way we had before was that we would go there, first on scene, and then all of a sudden, we had to make that call as, okay, are we going to apprehend this person under the Mental Health Services Act? And then if we did that, then we had to go to a doctor, and we'd sit into an emergency room. Sometimes we'd sit there for 6-7 hours sometimes as we were being triaged, right? And that was the only plan we had before. And it just wasn't an effective way to deal with people in mental health crisis. It just not at all, right? And we thought, we can do better. I know we can do better. And this project kind of started rolling. We have these little PAC teams around Saskatchewan right now. A PAC is a police and crisis team. And what the PAC team is basically it's a police officer paired with a mental health crisis professional. Could be a psychiatric nurse, could be a social worker, but training in that field. We have one in North Battleford and one in Yorkton. And so this is kind of in the spirit of that. So what the nurses in the OCC will do is basically do the exact same thing, but offer the support, like the service, to remote and rural Saskatchewan. So any place that the Saskatchewan RCMP serves, people have that access to call in and to speak with the nurses. What I want the public to know is that this is a new service that they can utilize when they need help and they are in mental health or a crisis or addictions crisis. Phone us. You can phone the dispatch center. There's resources right there to help you, as opposed to in the past where a police officer shows up not fully mentally health trained, and so now the public will know, or hopefully will know, that we have these resources right here, and hopefully very soon, 24 hours a day, 7 days a week.